Understanding about birth interventions in labour can help to give you back some control so that you can make informed decisions. I'm Lizzie, an antenatal hypnobirthing teacher, and I'm also a mum. In this video, I'll be talking about some of the interventions that you may be offered to help kick-start labour. A birth intervention is where your midwife or obstetrician will offer medical procedures or treatment to help kick-start labour or to monitor it. It is so important that with any intervention that is offered, you feel that you've been given enough information to make an informed decision. A handy acronym that can help with this is to use your BRAIN, and this stands for benefits, risks, alternatives, instincts, and do nothing. These help to give you a set of questions that you can ask your midwife when they offer you an intervention to see if it's the right thing for you. Hopefully, this handy tool can help you to feel confident and empowered if you are faced with making a decision during your labour. One of the main reasons that intervention, specifically induction, might be offered is down to your estimated due date. Now, I know this date is really exciting and probably etched into your minds, but please know that only 5% of babies are actually born on their due date. The World Health Organization estimates pregnancy to last between 37 and 42 weeks, but despite that, induction is often discussed at your 40-week midwife appointment and is usually advised to be given between 41 and 42 weeks. Different trusts have different policies when it comes to induction, but remember, your midwife should only be offering it. It is always your choice. One of the first interventions that may be offered to you is called a stretch and sweep or a membrane sweep, and this can be offered to you from your 40-week appointment. It involves your midwife inserting 2 gloved fingers into your vagina to try to reach the lower part of your uterus. The aim there is to try to release prostaglandin, a hormone that kick-starts labour. If this is effective, it can get labour started in as soon as 2 to 3 days. However, it is worth knowing that the stretch and sweep can bring on stronger sensations of contractions, and it can actually also create false labour. In 10% of cases, your waters may actually be broken accidentally during a stretch and sweep. If this were to happen, but your contractions weren't to start straight away, then an induction process would need to begin because there is an increased risk of infection to your baby. Induction of labour refers to labour that is medically stimulated rather than waiting to go into labour spontaneously. As well as going beyond your due date, there are a range of reasons why you may be advised to be induced. This could be down to the mother's age or her health circumstances. Look into your hospital's induction policy to see what the actual methods of induction are there. But in most cases, this includes applying a hormone gel to the cervix or administering syntocin on drip through an IV. Both of these are to encourage contractions to start. Induction is a huge intervention which can bring many challenges to both the mother and the baby, so it is really worth considering what your options are if it gets to that point. With all of these induction methods, the likelihood of needing pain-relieving drugs or further intervention such as ventouse or forceps, epidural, or even a caesarean birth does increase. Once you are in labour, how many centimetres dilated you are might be something that you think you need to know, but actually this is something that your midwife can offer you, and it is absolutely something that you can decline if you wish to. A vaginal examination involves your midwife inserting 2 gloved fingers into the lowest part of your cervix. It gives them a range of information, including whether you are in established labour, and this is classed as being 4 centimetres dilated. It is also used to check that you are progressing at the recommended rate according to the hospital's policy. However, we are not robots and we cannot progress through labour at exactly the same rate. As long as you and your baby are healthy, labour doesn't need to be rushed. As always, if you would like to know more about induction processes to start off your labour, do chat with your midwife. I hope you have a really positive birth experience.